implement with regard to outreach eligibility at that point, how you get people enrolled. Yeah.
Any estimates of how much, say, of GDP will be spent on healthcare afterwards?
Yeah. Yeah, well, so you might remember that the Congressional Budget Office did assume that this, or did make a projection that this would actually save money. It would reduce the deficit over 10 years.
Reduce the deficit, but not healthcare spending.
Right, it reduces the rate of increase in healthcare spending. Again, so many assumptions have to go into that, and we'll have to see over time. And they were talking about a 10-year horizon when certain things if there's certain fees that come in then. You know, one of the big things that I didn't talk about today is that in 2018, people with what's called Cadillac health plans get taxed on those health plans. And we've yet to see the exact definition of what Cadillac health plans will be. We know what the dollars are, but we don't know what it'll be in 2018. And so, you know, there's revenue that comes in to the federal government. If you look at the CBO analysis, which we've done, and you look at all of the things in there to try and what they call, I really hate this phrase, but everybody uses it, called bend the cost curve. Not reduce healthcare spending, but reduce the rate of increase. There's actually relatively little assumption that the Congressional Budget Office made that these things would actually reduce the curve. And so what I would say to you on this point, and it's one of my favorites, and it's a whole different talk, but I'll conclude on this. This issue of healthcare spending is a very complex issue. There is no silver bullet. I told you about comparative effectiveness research, but it gets mischaracterized as death panels. There are examples like that all across the board where you start, and one of the reasons HMOs failed to really keep the spending down in the late 90s is because there was this huge managed care backlash. They had to back off from some of the things that they were doing to manage healthcare costs. Basically, Americans don't really like controlling healthcare spending. There is nothing that's popular about that. Because our view, this is very different from Europe, very different from Canada. Our view is we want everything, we want it now, and we don't want anybody telling us when we can have it. And that kind of comes back to our, you know, life, liberty, and pursuit of happiness theme here in this country. It's very much built into our American view. And so controlling healthcare spending, we know ways to control healthcare spending. They're choosing what you pay for. They're taxing high-cost benefits. These are things that are anathema to Americans. And so I think it's going to be very hard to see a huge cut in healthcare spending without doing those things. Instead, what I think we have to do is as I said, there's just about every idea in the bill, in the law, that anybody's ever thought of. And basically, I think we have to do everything. Just throw everything at it, anything, even if there's just a slight savings, that's good. And over time, it builds up to do more. But I don't think this country's ever going to want to really do the radical things that will really cut healthcare spending. And I think it's 1 o'clock. And with that, I thank you all very much.
And on behalf of the Wolverine Caucus, we want to extend to you our deepest appreciation and share with you this wonderful 14-karat gold Wolverine Caucus pen. Thank you. Thank you. Thank you. Thank you. I wanted to mention that we were also joined this afternoon by Representative Mark Corriveau and a host of key staff from legislative offices. Also, we do thank Dr. George Rowan for joining us this afternoon, and Rick Bossert from the UM Health Systems, and Dave Lansing from the UM Flint campus. Thank all of you for coming. We appreciated you being here. If you did not receive a packet of information and would like to, please see us afterward and we'll make sure that happens. And other than that, have a wonderful summer, and we will see you again in September when we talk about elections 2010. Take good care.
To the left. Okay, we just take it to the restroom. Yeah. Oh. probably would be covered.
Very good. So do you broadcast this? I'm from the Detroit area, so I'm not familiar with it. Okay. Okay. All right. Okay. All right. Okay. Okay.
Easiest to see.
Okay.
Sometimes we're way up there. Lansing,
Most of us would say, well, I'd like to say, right, but I'm not going to do it.
Okay. Well, that's good to know.
Unless you die first. Yeah, I think that there is that.
Yeah, there's a sense because this is our future for this.
Right, but, you know, sometimes it's
It's an interesting topic.
yes.
Keep it posted.
All right. Hey, it was worth the price of admission.